So in case you're wondering why I'm back here, not that I can ever substitute for Dr. Shidepuria, but we did feel that a little more content would be good at this point, but also the extended practitioner panel. Fortunately, as you might have guessed, I did have some spare slides. So here we go then. So I've already talked about lots of inflammatory syndromes which have been implicated in long COVID, but actually I only touched on the problem. Let's have a look at all of them. But first of all, let's define a syndrome. This is a set of medical signs and symptoms correlate with each other and they're associated with a particular disease or disorder. A syndrome actually tells us nothing about the cause of the disease. All it is telling us about its components, which may or may not be similar to other syndromes. So let's have a look. All of these have been implicated in COVID-19, and it's been suggested that they are causal. Well, okay, but they are only indirectly causal because something has to cause the syndrome. So you'll have seen some of these before because I looked at them under inflammatory conditions, and some of them have been mentioned by other speakers. But we'll just take a quick canter through what these actually are. So firstly, post-viral syndrome, which you probably heard of. So curiously, I discovered in my PubMed search, other than in connection with long COVID, no study has looked at post-viral syndrome since 1987. Now, I was frankly stunned. Nevertheless, that's the fact. So it's obviously post-viral syndrome isn't new. Here we see the first mention of it, at least in the West in 1892. But even Anthony Fauci has acknowledged that this may well be involved in long COVID. So that's actually been quite useful. So post-intensive care syndrome is next. This does what it says in the tin, really. Nothing very exciting about it. Chronic inflammatory response syndrome. This is a SIRS, rather like the SIRS we've looked at already, except this one is a term coined by Dr. Richie Shoemaker, which many of you will be familiar with, and is associated with exposure to biotoxins. So these are biotoxin illnesses. But what is SARS-CoV-2 if not a biotoxin illness? And certainly there has been some studies on this. And Dr. Richie Shoemaker himself has said that it's probably implicated. Central sensitization syndrome is another one of those. Mast cell activation syndrome. This has been mentioned by both the previous speakers. Chronic fatigue syndrome, just to remind you that it's not just about fatigue, but here is a really useful review article which identified apparent causal events of chronic fatigue syndrome. Infections came in at 64%, stressful incidents 34%, and exposure to environmental toxins 20%. So if you add all those up, you'll see that actually we get to more than 100%. But that's because patients are almost certainly going to have at least one of these, possibly two or three. So that's quite a useful study there. Here's POTS again, macrophage activation syndrome. So when you think that all of those have been suggested of mechanisms of causality in long COVID, many of them involve inflammation, as we've seen, not necessarily all of them. But how many syndromes have we got there? And how many syndromes are enough? So let's have a look at other viruses and see if we can learn anything useful about long COVID from them. So is SARS-CoV-2 a novel virus? Well, from the beginning, a lot of people have been referring to it as such, and including as recently as this winter, the BBC Science and Health correspondent called it a novel virus. But it's not novel. The clue's in the name, SARS-CoV-2. there was a SARS-CoV-1, which is the original SARS from back in 2003. So it's not novel, and nor does it have novel post-viral effects, as we'll see. So, having looked at the studies, I picked out all these viruses that actually have post-viral effects. So let's have a look and see what they are. Lungs, first of all. Obviously, most of the studies have been done on SARS-CoV-1. It's fairly recent and it was pretty serious. So that's going to come up a lot. But as you can see, it's by no means the only virus coming up here. MERS is another coronavirus, by the way, Middle East Respiratory Syndrome. Cardiovascular disease, SARS-CoV-1 again. All of those long COVID symptoms come up in SARS-CoV-1. Neurological and mental health. Look at that, PTSD again, depression and anxiety, SARS-CoV-1 and plenty of others. And look at the number of viruses that have post-viral fatigue following. Just about all of them, actually. We've got musculoskeletal problems, hypothyroidism, SARS-CoV-1, new onset diabetes, not just common to COVID, but to all these viruses as well. Interestingly, that's particularly type 1 diabetes, the autoimmune condition. Then we've got the two suppressed immune systems and T-cell hyperactivation, both seen in SARS-CoV-1. So let's see if there is anything else to be learned from these. Let's look at the lungs, first of all, because these SARS-CoV-1 can tell us a lot about the duration of the symptoms. So that is actually going to be quite useful when we're only just 2 years after the initiation of COVID-19. So here's a CT scanning study, 15 years after SARS-CoV-1. Pulmonary lesions had decreased from 9% at year 1 to 3% at 2 years, but had risen again to 5% after 15 years. So do you remember we saw this trend in long COVID, that you can get better in the first 5 to 6 months, but then after that, the recovery tails off, so that after a year, maybe only 50% are better. So here you've got actually lung problems getting worse after year 2, which is a little worrying. But there is another study that shows a gradual reduction in lung lesions up to year 7. So that's slightly more encouraging. Cardiovascular disease. So here's SARS-CoV-1. Pneumonia, 35% of hospitalization cases had cardiovascular disease events. The risk was highest in the first year, but it remained significantly high for 10 years. Musculoskeletal, femoral head necrosis decreased from 39% at baseline, 30% at year 2, but only 26% at year 15. See, the trend is continuing. Mental health, SARS-CoV-1, 42.5% at least one active psychiatric illness 3 to 4 years after recovery. And here's a systematic review of people with SARS-CoV-1. But PTSD, stress symptoms were present in high proportions of survivors at 4 to 5 years. And survivors of Spanish flu, this is in 1918, and by the way, this pandemic killed more people than the First World War. A lot of them suffered mental health consequences, and quite enlightened for its time, they actually diagnosed this as encephalitis lethargica, brain inflammation. Probably was. Fatigue, 3 to 4 years after recovery, 40% reported persistent fatigue, and 27% met the CDC criteria for chronic fatigue syndrome, which is quite rigorous. So that's SARS-CoV-1 again. 5 years after Q fever, 69% of patients reported fatigue, and the CDC criteria were met in 42% of those cases. Ebola has all its own problems, as you probably know. And medication again. Do you remember I said in SARS-CoV-2, we've got problems with overuse of steroids in the acute phase. Here we have it again, SARS-CoV-1. What a surprise. Okay, that's me done. You'll be relieved to hear. So now we're going to move to our practitioner panel. But I have a very important thing to say, first of all, and that's this. It's a message from our sponsor. I've seen the questions coming up, and so I'd like to say that we are not able to enter into a discussion on the efficacy of COVID vaccines today, because we wish to focus on helping people with long COVID. We don't have any vaccination experts here, not that I'm aware of anyway, so our discussion would inevitably be unsatisfactory. But it's much better if you just avoid questions, please. Thank you very much.